So before getting into the stent, I want to discuss about the pathological process in the heart, which is cause of like top killer in the developed country, such as in the USA. So let me first start with this heart. So heart is an organ which is probably one of the most important organ, because without heart, we cannot survive. And it works 24 hours. And you can see in heart, there's left ventricle will push oxygenated blood through this aortic arch, and some part of the blood has to come back to feed the heart muscle, cardiomyocyte. And this vessel is called coronary artery, which is located on the surface of the heart. And what if this plaque is forming inside this coronary artery? So you can see this plaque, and that will narrow down the lumen. The lumen is in hollow space inside a tube or blood vessel. So the lumen is narrowed down, then it's harder to push the blood into, so it's hard to support oxygenated blood to the heart. So this is causing a big problem. And not only with that, so you can see narrowed heart and plaque, and this narrowing down can cause angina to the patient. So my mom has an angina, which is a symptom that the patient will tell, like, elephant is pushing your chest. That kind of symptom is a sign that she or he might be suffering from this plaque formation and narrowing down of this coronary artery. So once we found this, we need to do something to enlarge, reopen this narrowed lumen again. So for that, humans, we developed various techniques. In some cases, we have to completely replace this part of the vessel by taking off a big vein in the patient's leg and then bypass this spot. So that's called coronary bypass surgery. While less invasive procedure is this. So this is a catheter, and catheter is a medical thin tube that can be inserted into a body cavity, duct, or blood vessel. And by using this catheter, we can deliver stent, which is initially closed, and later on we want to use a balloon to expand so that we can open this plaqued area. So this shows how to deliver stent with the catheter and through the guide wire, and you locate this. How do we see? We actually use X-ray to observe in real time what's going on. And then when we are placing in a right place, we actually push pressure so that we expand the balloon, which will expand the stent as well. And then we suck the balloon, collapse the balloon down, and then withdraw this stent so that the expanded stent will remain here. So stent to widen this part of the artery, and it compress the plaque, and the blood flow now regained its normal flow. So this is compressed plaque, and you can see this widened artery and cross section of a stent. So the stent, if I define, is an artificial tubular structure which is inserted into a natural passage or conduit in the body to prevent or counteract a disease-induced localized flow. So there's a very interesting story about the stent. The Boston Scientific, a major company for stent, whose one person from there will talk about us. That stent is very difficult initially getting into the medical community, because previously, without this, usually the surgeons will take this place, and he or she has to do bypass surgery, which requires an open heart surgery. You have to open up your chest and expose the heart, and then bring this coronary bypass from the vein of the leg, and then you have to do this surgery, which is a major, major surgery. However, this stent technology, to bring this stent with a catheter, do not need to open the heart. It just goes through a part of the blood vessel, such as femoral artery. So only a small hole that goes into the artery and goes to the heart, through the heart, and finding out this affected area of the coronary artery and do it. So it uses our body's natural blood vessel or conduit. So you don't have to do major surgery. So this simplifies a lot. But initially, this has a lot of resistance in medical community because it hasn't been done before, and only gradually educating the surgeons who are open-minded and try this and figure out the troubleshoot, and then gradually people realize the benefits of this stent technology. However, there's a big problem. Of course, you can ask, look at this, stents is like wired, loosened wired structure. And what if, how long does the stent live? So the stent may sustain depending on patient. However, you look at this plaque can regrow and make this lumen narrow again. And that process we call as stenosis or re-stenosis in this case. And that has become a problem because you have to undergo this procedure again. So people think about this problem, then you need to attack why the plaque is growing and how to prevent the plaque from this stented part to regrow. So that mechanism is related to immunology and many parts of the fundamental of basic medical science. So people developed a new idea of how about putting a drug which is interfering this process and coat the drug onto the stent itself. But this has to be well designed that the drug has to be slowly releasing its effective molecules and agents so that it prevents the plaque from regrowing. So this is the technology, an idea called drug-eluting stent. So drug-eluting stent is you coat and the drug on the surface of a stent, which is usually metal, and controlled release of the drug will prevent the plaque from growing and prevent re-stenosis. So this is a wonderful idea. Now, even this is more expensive, many patients and many procedures actually use this drug-eluting stent. So elute means to remove by washing with a solvent. Now, let's change our gears to another interesting example of brain tumor. So there are a number of kinds of brain tumors. One of the most dangerous one is called GBM or glioblastoma multiforme. So this malignant glioma, do you know what the mortality rate if one gets this glioblastoma multiforme? It's 100%, and it can kill the patient pretty quick. So this is a major challenge in medical society. And one of the problem is when you have a drug, either orally or IV, the drugs do not usually get into the brain parenchyma, which is the tissue itself of the brain, due to our natural mechanism of blood-brain barrier. Because of this, it's hard to deliver drug properly in the location. And so one of the MIT Institute professor, Bob Langer, while discussing with clinicians, he's got a good idea. So how about directly put the drug into the tumor site? After the surgeons remove the tumor, why don't we just put the drug onto the site and slowly releasing the drug over time, which can kill the remnant tumor? Because the GBM procedure, the surgeons goes in and then try to look for the tumor and tumor boundary. He actually resect the tumor. The problem of this malignant glioma tumor is the boundary is not well defined. And so it's almost impossible to find out all the tumor cells with the margin clearly defined. So there are gonna be remnant tumor cells which will eventually regrow and kill the patient. So this GLIDEL is a small disc or wafer structure where you put the drug in and then control release of the drug over time. And in this case, GLIDEL has a calmustine, which is an alkylating agent which prevents DNA replication in the treatment of malignant gliomas. So this was the only treatment for malignant glioma approved by the FDA and the European Medicine Agency. So in 1996, FDA approved this GBM treatment, the use of GLIDEL. So how do we do it? After surgical resection of a brain tumor, up to 8 wafers or discs of these are placed in the tumor resection cavity for a controlled release of local high dose of chemotherapy drug to the surrounding tissue to eliminate the residual tumor cells, such as this allows no need to cross the blood-brain barrier through other routes of drug administration. So here's a schematic how to do it. Up to 8 biodegradable discs are implanted in the brain cavity after the surgery. And these discs release chemotherapy drugs, calmustine, which continues the active treatment of the tumor while patients await radiotherapy. So the size is like a small coin. And this drug, wafer or GLIDEL composes of biopolymers, which is a biodegradable, which allows a slowly releasing of the drug. However, I should say this GLIDEL is also not perfect. I mean, any approaches, we should see like the big good idea, but we also have to assess the results. And there's also involves an adverse event. So with GLIDEL wafer, so one is brain edema, which is expansion of a brain with the watery content, and healing abnormalities. So it can also leak out cerebrospinal fluid, which sustains the brain in buoyancy. And also there's a higher risk of intracranial infection. Thank you for your attention.